Good morning, Professor. My name is Sandra Manu, and my group member is.
Good morning, Professor. Myself, Bensimol Bensigar.
We are here to present our capstone part 3, and the topic is vaccination among the healthcare workers. Moving on to the introduction. The chosen topic revolves around the imperative need to increase immunization rates among healthcare workers with a special focus on nurses in the Greater Toronto area. This is a critical Canadian healthcare issue, particularly in the wake of COVID-19 pandemic, where vaccination become crucial for both individual and public health. The objective is to create a safer healthcare environment by reducing the spread of illness within medical facilities, improving patient safety, and promoting a culture of vaccination among healthcare professionals. Moving on to the next slide. Why is it a Canadian healthcare issue? The vaccination of healthcare providers is a critical concern in Canadian healthcare as it directly impacts patient safety and overall safety of healthcare facilities. In the context of infectious disease, healthcare workers serve as a first line of defense in patient care, making their vaccination status a crucial quality and safety issue in nursing practice. The topic is deeply rooted in the need of safeguard public health in a dynamic healthcare environment. Here are some list of solutions that helps to resolve our problem that is the vaccination among the healthcare members. Some set of solutions are by setting the SMART objectives, assessment of current situation, involvement of relevant parties, by giving education and training, by improving access and convenience, by giving an approach that is servant leadership approach, data collection and monitoring, and continuous improvement. By setting these solutions, we help the healthcare members to set up solutions and may improve the vaccination among the healthcare providers. Then moving on to the evaluative outcomes, there are a certain set of evaluating outcomes that are baseline assessment. We need to assess the baseline and we need to implement implementation of interventions by monitoring the data collection, comparison with baseline, use of health quality Ontario data, statistical analysis, feedback and adjustments, and documentation. Moving on to the next slide, that is barriers. There are certain set of barriers that resist the staff to change. First one is the staff resistance to change, data collection challenges, inadequate resources, patient and family engagement, communication gap, a lack of standardized process. These are some of the barriers that holds a nurse to holds from vaccination among the healthcare providers. Next, my friend will continue with the next slide. Thank you.
So good morning. The next is the impact. There are mainly three areas that has main impact. They are staff, leadership, patients, and community. So first one is the staff. The main positive impact on staff is the collaboration of work and the communication. They maintain an effective communication and collaboration. So by that, they can give an effective care. Then on the leadership, they will come to know the effectiveness or the productivity of staff, and by that they can make a greater change on the staff. Then next one is the patients and community. By maintaining a proper communication, patients and communication, the family of the patients will also get a trust upon us, and by that they will get to know about how to give more care to the patient when they are at home. And the next is the outline for sustainability plan. That is continuous monitoring and evaluation, education and training, integration and organizational culture, patient and family engagement. That is, after giving the vaccination, we must continuously monitor and evaluate evaluate. Then after that, education and training, and health education must be given to the clients who are taking the vaccination about what all things that they need to be kept in mind when they are at home. Then integration and organizational culture and patient and family engagement. Family and patient must be also aware about the things that they must be kept in mind. Next is the leadership theory or the style. The leadership theory that we have used here is the transactional leadership style. That is commitment to patient safety, resource allocation, communication skills, and promotion of continuous learning. The next one is the resources that are required to sustain change. There are many resources, and among them, some of them are financial resources, human resources, training and educational resource, technological resource, time and commitment, collaboration, and networking. The main basic resources that we need are the financial and human resources to get a better quality of vaccination and to get a good environment. So finance and human resources is very important. Then training and educational resources, we must always, as I said earlier, we must always give a proper in-service and continuous education. Then technological resources, time and commitment, collaboration and networking is also very important. So next we are moving on to the conclusion. So far we discussed about the topic that is the vaccination among healthcare providers, the main barriers, the main impact, and the leadership style. That the leadership style we use is the transactional leadership style, and the resources that are needed. So thank you. I hope you enjoyed the topic. Thank you.